All right, so why do you have movement loss with a disc or spine injury? All right, Jake, so let's talk about why someone would have movement loss or typically show a movement loss in one direction with a spine or disc injury.
Yeah, so I'll bring up the model here. And if you can see, if we have a little bit of, we call it a joint arrangements. There's some piece of tissue, in this case, I'll demonstrate with a soft tissue bulge there on the disc. It gets inside that joint space there. So you cannot clamp down back on it. Usually in the low back, this means you cannot extend backwards. That's where you're pinching down on that piece of tissue, and that's in the way from letting you move back freely like you would normally be able to. So the direction that you normally get stuck in this case we're talking about the low back, is often the one you actually have to move into to reduce that little soft tissue obstruction, push that back in towards the center so your body can move freely in those directions. The disc can be at play, you can have the joint irritation, inflammation, there's a bunch of different things can go on. You can also get some muscular tightness, which is more of just like a reflexive response to pain. Your body will tend to try to lock itself down so it doesn't move because it's trying to just restrict you and not let you move into those aggravating movements. Yeah.
See, like Jake said, you'll almost always have a loss of motion with a disc or spine injury. Now, typically it's going to be what's called the sagittal plane. So what that means for you guys is it means either forward or backwards. And you'll usually feel that. You'll either kind of feel stuck forward or you won't be able to bend forward. Or after sitting, when you try to rise, it's very difficult to get yourself upright and straight. And that's what Jake was talking about with that space occupying lesion, something. It could be soft tissue, it could be a piece of the disc, it could be something else that's just taking up space that doesn't belong in. And when it does that, the mechanics of the joint aren't working correctly, so they don't move right. Now, this is the most common direction in which the sagittal plane. The next most common would be in the frontal plane, so your ability to kind of shift side to side or move this way would be the next one. And then third would be like in this transverse or rotational plane, you could have a loss of motion. But that's very common. That's the reason why, and it's one of the things that we'll check as far as a baseline or how to a prognosis meter or like a measuring strip. So all of a sudden, we started. I can only go this far. I can only go this far. We do some movements. We do some treatment. Okay, now I can go this far and this far, even if it still hurts, but the mechanics are changing.
That's a good thing.
We know we're on the right track. We're in the right direction, and so that we want to keep progressing with that and continue to gain motion in all of those directions. And typically, what's kind of cool about it is that usually you will gain in all of the directions by moving into just one direction, which is kind of neat. So once we find that, and if you do have that, what's called directional preference, then all you have to do is continue to work into that and then just progress the force.
Yeah, and then once you learn what movement your body responds most to, then you can kind of gauge it and teach yourself, okay, you're going to stiffen up if you're sitting for a period of time, but you know what movements to correct that, and you can manage it on your own. And you just become aware of what movements are going to aggravate you and what movements can make you better. So you can use that as a tool on yourself to self-manage and self-direct what you need to do on your own.
There you go. That's why you typically will have or experience a movement loss with a disc or spine injury, and why it's very variable. It's not always the same. Some days feel more stiff, some days feel a little bit freer. In fact, within the day, within the hour, you can all of a sudden oh man, I can move a lot better, and then all of a sudden, now I'm kind of stuck. That's why, because it's a very dynamic situation and very changeable pretty quickly. So thanks a lot for the question. Hope that answers the question for you.